we can't get away from it. It's set by society, it's set by government, perhaps, it's history. Everywhere we go is culture.
It's power, it's privilege, it's discrimination, it's disadvantage or marginalization. Like all of these things are, inherent in culture. And so if we just pretend that's not there, we potentially can do a lot of harm. Am I perfect? Absolutely not. But am I trying to reflect and trying to, be self-aware and aware of other groups? Absolutely.
Hello and welcome. We're so glad you're tuning into the Taking Good Care show. I'm Dr. Andrew Wong, based in Toronto, Canada.
And I'm Dr. David St. Arnaud, based in Edmonton, Canada. We're two practicing psychologists with over a decade of experience each, working in a variety of settings and supporting diverse populations.
Thanks for joining us. We hope you enjoyed today's episode. While we're both practicing psychologists, our podcast is intended purely for educational and entertainment purposes. It's not a substitute for professional mental health care or treatment. If you're in need of support, we strongly encourage you to reach out to a licensed mental health professional in your area. Dave, we are back for round 2 of culture and psychology.
Yeah, I think, this has gone in a bunch of directions. We didn't script, right? So
Yep.
this is an organic discussion. So we'll pick up a bit, and I think we'll, maybe more focused on like applying this to the therapy room and what this might look like, meeting with a psychologist or a mental health person. Yeah, but before that, I think one of the things that goes along with all that we've talked about, but we haven't really named, is privilege and power dynamics or power imbalances, right? And so much like we don't choose the family we're born into, and there's a lot of things we don't have choice over that affect, our cultural background or our status, our socioeconomic status. Privilege is the other end of kind of that. Like we didn't really say like these can be negative things, but in a positive way or advantage wise, we don't have like the privilege. The definition of privilege that I like to hold is like these are advantages that I didn't ask for or didn't earn, right? So
Mm-hmm.
there's nothing I've done or worked hard for that gave me these advantages. Of
Mm-hmm.
course, yes, I've worked hard and done a lot of things to get where I'm at. But again, my skin color, depending on the culture I'm in, might be an advantage, right? My gender might be an advantage. My sexual orientation, my family's socioeconomic status, and how
Yep.
much money my family had when I was born into this world, right?
Yep.
There's a neat little video that talks about privilege. There's one on YouTube. There's a couple of them actually, but it basically kind of asks people questions. They're going to have a race for $100. At the end of the finish line is $100. But before they start, they ask people to take a step back if you grew up without two parent household, right? So you were in a single parent home, you take a step back. You grew up in a culture where your religious holidays were not recognized, you take a step back. And like there's different questions like that that start to tease apart some of these like inherent advantages that some people have and other people don't. And then they go, okay, now start. And so
Yeah.
is the race really fair if we're not all starting from the same place? No. And but we tend to, at least in the West, we tend to de-emphasize that, right? It's like, oh, if you just work hard, you'll be able to succeed. That pursuit of happiness will be there for anyone who tries hard.
Yes. I guess that piece around hard work, it's relative, right? Like we have to think about it. And even when I talk to students, they will say I worked really hard, but did they work harder compared to another student?
Mhm.
Maybe not. So they'll say I worked hard, but then they didn't get what they wanted, right? But it's sort of like to your point about where did you start, right? If you were a student who did nothing, like just cruised in class, did no studying, took no notes, and now you did 30 minutes of studying, that to you might seem like a lot of hard work, right? But to the student who did keep up in class, submitted every assignment, and then studied insurmountable hours to get the, 95. Like that to them relatively is a lot of hard work, right? So that starting point is so important to think about.
It is, and I think now we're going down a path that I wasn't sure we were going down. But so effort, right? How do we actually measure effort, and how do we reward effort, or how do we reward and like an advantage? Not that we're like trying to reward something, but like how does the culture or the system or the government or the school that we grow up in, rewards skill, right? Like people are born with certain athletic abilities or intelligence abilities, right? And it might not be focused on effort. It's like, well, whoever gets the highest grades is the one who moves up and gets the scholarship,
Yeah.
right?
Yeah.
Or do we have scholarships for certain groups of people to try to even out the starting point or the race? And again, this is where we'll go back and forth, but if we just understand that there is inherent privilege, right, and it does not apply to each individual,
Yes.
you could have white skin and be male and have, a lot of disadvantages. You could have grown up in poverty and abuse and, and you would say, well, I'm not privileged, right? And it's like, well, if we look at how privilege works, you might be privileged, you might be disadvantaged in a lot of ways too, right? So that's where this gets messy. Is it applied to the group? Is it applied to the individual? And then we go back and forth and we'll have these debates on and on.
So how do we apply this to the therapeutic setting? So if we're going down that funnel that I mentioned in the last episode, right, we had this broad-based discussion on culture, and you can probably say identity as well, culture and identity and where we're situated, Dave. How does this impact our practice? What would this look like in the counseling setting when it comes to perhaps understanding other people's cultures or recognizing our own biases within the therapy setting or assessment setting too? How do we want to take this conversation into the therapy room?
Well, I think looking at the history a little bit, right? And so, cultural competence was a huge shift from the way things were happening before, and before I was trained and practiced. So, my understanding is that experts, usually older white males, were telling people what was good for them, right? And so they had therapeutic approaches and they were applying this to people, and people came to them to learn something to improve their life in the definition that was kind of given to them, right?
Yep.
And so cultural competence started to ask some questions about like, should this therapeutic approach or this intervention or this way of working with people, does that really work for all people? Like maybe that's harmful to some people, right?
Yeah.
And so how do we make this more culturally sensitive or relevant to people's values and beliefs about health, mental health, right? Like,
Yeah.
so again, this gets kind of messy, but it's like these are the questions I think if you're a practicing psychologist that you should be asking yourself, like, and having conversations with the people you're working with, especially if you feel like there is a misalignment here, right?
Yeah. Yeah. And I think to put it as an example, even for myself, I think because psychology, I'm gonna put it out there, is still predominantly a white profession, right? It's like you said, situated more so in Western culture. A lot of the research is in Western societies about psychology. It's interesting when I do get individuals who are just requesting, let's say, a Chinese psychologist, or
Mm-hmm.
better yet, a Chinese male psychologist who can speak Cantonese,
Yeah.
right?
Yeah.
So I do get those requests, and I think that really emphasizes, that people within society, they are still a lot of the time comfortable with their own group, right? And that's what they're seeking out.
For sure. And I think if we want to be understood and valued and appreciated, finding someone from your background, from your experience is really comforting, or at least a starting place, right? We
Yes.
yeah. So I'll get referrals for the gruff guys that work in the oil field, because I grew up, blue collar working in the oil field all through my university, right? And so when I share that, some people are like, "Oh, okay, you get it," right? There's an assumption that like you get it and other people won't get it, right? So how do we make space and open discussions up to like get other people,
Yeah.
regardless of whether we come from the same experience? Because my experience in the oil field might be very different than someone else's experience in the oil field. And if they assume I just get it because I've had a similar experience, we might, be making a lot of mistakes, or we might not be as helpful as we want to be.
I'm gonna ask you this, Dave, and I'll give an example for myself when you said like because I they think I get it, right? Do you truly feel like you get it, or sometimes you don't? Because and I'll use myself as an example here, right? So I go back to the example of someone who asked for a referral for a Chinese psychologist, male, speaks Cantonese, fine. But a big part of me also thinks, and maybe there's a bit of imposter here for my own culture, is that I've been here since I was 5 years old. I don't speak with an accent when I speak English, right? I grew up in a predominantly white neighborhood. I went to University of Western Ontario. Like, come on, like study psychology. Even though in my family we still continue to keep up with festivals and we try to promote our native language as much as we can with my own kids. And we still, we still do a lot of the traditions. I don't know. Sometimes I feel like they may be like what are they expecting? Like how immersed do they expect me to be?
So you feel the pressure to like
Sort
represent
of.
yeah, and
Yeah.
like if you
Because where else are they going to find a Chinese male psychologist? Right? There's like, I don't know. I'm just going to throw a random. There's like five of us out there in this city of Toronto where there's millions living. And there's like
yeah,
just a few of us, a handful of us. That's it.
yeah,
Throw in there, I want someone who's young or at least looks young. And
yeah,
like now there's like two of us.
yeah.
Like,
But if you can understand that people are going to gravitate towards that, and certain people will, right? Like
yeah.
because they assume that in some ways you will understand them better than someone else who doesn't look like you, doesn't come from, like they're they're seeking that out. And so I think about this more generally, but what about like someone who's been through a similar challenge in life, like someone who's, had major depression, right? Or someone who's been sexually abused as a child, right? And so someone who's looking to get support around that specific thing might look for someone who also has that experience, because some people are more open about that than others, or like there's even
Mhm.
podcasts like this where people are going to know more about me than if they read my bio. So but the assumption is that they are going to get me, they're going to understand me better, and so I'm going to look for that,
Right.
right? And so I'm always telling people like there is advantages to that. Like it is quicker, it is oftentimes a lot of the assumptions are correct, and we don't have to spend a lot of time like asking basic questions.
True.
So same thing with culture, right? We can just be like, I get it, we get it, this is how we talk, or this is how we act, and we don't have to question each other about it. But the disadvantage is if I come from a same experience, I might assume that your experience is the same as mine, or you might assume that my experience is the same as yours. And that's what you're saying.
Right.
You're like, oh no, how much do I have to be what they're expecting me to be,
Right.
right, in this relationship? And so I just like open it up to like, if I don't have the same experiences of you as you, or I come from a different background, I'm going to ask different questions, and there's going to be
True.
advantages to that, right?
Yeah.
The other way, there's advantages to kind of getting it and possibly making false assumptions or not asking the right questions, right? So
Yeah.
pros and cons to each side. One's going to be slower, one's going to be quicker, but yeah,
It's funny as you were talking about that and like just being quicker to understand each other. One of the comments I often get when I do see other Chinese clients, it's you were beat as a kid, right? It's like, and it's sort of like this sort of amusing anecdote, but we get it,
yeah,
right? We get each other. It's not like, oh my gosh, you were beat. It's like, hey, that was just part of Part of growing up, man. Yeah, I was beat. You were beat.
Yeah. And again, if that's true, then it's like, oh yeah, we get it, right? And even the way people talk, they'll say like, you know, and if you know, then you know. But if you don't know, you're like, what are you talking about, right? That was your
Yeah,
experience? Oh, tell me about that. Help me understand that. Yeah.
yeah. And then yeah, you get people like, oh, it wasn't a big deal, right? So to the person who may not be aligned culturally, you're right. Maybe like, oh my goodness, like tell me more. But to the person who is aligned, it's like, yeah, that was just part of our culture growing up. Like, you know, Chinese
Mhm.
parents a lot of the time beat their kids,
Yeah.
right or wrong. That was the experience.
Again, though, right or wrong, there's pretty strong beliefs about these things, right? And so to be able to hold off our initial reaction, like I know even working with like indigenous clients, I have to be way more open-minded than I think that the way that I grew up, right?
Right.
And I'm like, oh, how does that work for you? Like, how is that a healing practice? What does it mean to engage in ceremony, right?
Hmm.
And even just like from my own Western scientific lens, right? Like to be able to understand what is like a question of like, what does healing actually look like
Yes.
for you and your, you could say your culture, but you could just say you, right?
Yeah.
And you'll get a
Yeah.
sense of the upbringing and culture.
So a lot of defining what certain terms mean, even terms that we may take for granted, like healing or trauma, right? What does all of that mean to you? And this idea of even improvement. Okay, what is improvement? Right. So yeah, in the therapy setting, I think from the get-go, understanding where your clients are coming from, where do we stand? And I think I'm pretty open in the therapy setting with letting people know what I don't know and what I do know. And, can you elaborate a little bit more? Because I'm not from that particular culture, or, I'm not from the country where you're coming from. And so I'm usually quite honest about that. And I hope it bridges or connects us in that way.
I mean, how much time do you spend talking about yourself and your own background? And yeah.
Not much. Not much. Unless, and actually, this is a good question. I tell this to my supervisees. If I do disclose, it's coming from a clinical or a therapeutic basis, right? Where I think, okay, here's a client who may benefit from knowing a little bit more about me, as we are at a point where I think we can even further our therapeutic rapport and we know each other quite well already. Right. So not from the start, I don't typically share too much about myself because it's about them. Like from my therapeutic lens, it's about you, and I want to
Mhm.
know more about you. But as I get to know the client a little bit better, I will tell a little bit more. And I truly think clients appreciate that. And it was interesting because I work with so many families and children. So I used to have my practice in my home with a separate entrance, and the practice would be in the basement. And this is when the practice was very small. But in a way, it was funny because I think clients appreciated this. They saw that I was sort of like a regular Joe Schmo. Like, I have my stuff to take care of, and they understood. And people were actually kind of nice about it. And they would get a chuckle if they saw my kids playing out in the lawn. And this is when my kids were way younger. But I think people actually enjoyed seeing the therapist as a person.
Yeah, I think some people will be attracted to that, right? They're looking for that human connection as
Yeah.
much as that like professional relationship. So I always make a point to like say when I'm first meeting with someone at the first appointment, I'll say, before you share a bunch about like who you are and what you're here for, do you have any questions about me, my background, my training? So I open it up and a lot of times they're like, nope, we're good. I'm like, okay, if you're good, I'm good.
Yeah.
But I'll add that, like, if I say something that you're not sure where it comes from, it's confusing, or you have a question about it, feel free to ask me.
Yeah.
because it's going to come from my lens, my background, my training. So by all means, don't just assume that this is, like you can't ask me these questions. And then, for those that say, well, tell me, like, yeah, sure, tell me what school you went to, okay, but tell me a bit about yourself. So it's pretty open ended. I'll
Yeah.
say, well, I grew up small town community, right, rural Alberta, raised Catholic, white, Ukrainian, French background, right? Like, so I'll just kind of hit some of these points, and I'll watch because I just had a session recently with a new couple, and I mentioned small town, and they were like, oh yeah, we're from small town, like pick a couple different provinces, right? And they're like, there was this like head nod, like, oh yeah, small town, I get it, you get it, kind of thing. And I'm like, I'm not sure if I get it. I'm gonna hold that like you think we have a similar experience, right? But I'm not gonna assume that my small town was the same as your small town in a different province, right?
Yeah.
But again, these are the ways we like build connections with people, right? And we talk about our background a bit. And if there is commonalities, those connections can strengthen a lot of times, even if they're not the same.
This is so interesting as you're saying this, Dave, because I'm like sitting here reflecting and being introspective. Like, I probably get more of those questions about where I'm from and how long I've been here from other Chinese clients than I do from clients of any other background. And it's interesting because I do wonder if they're sort of trying to figure things out or size me up in terms of how much do I understand the Chinese culture still,
Mm-hmm.
or are they just genuinely curious? It's interesting. Like, I don't get those questions, and maybe I don't know. Maybe it's the way I carry myself. Maybe I'm not as stereotypical as as people would expect. I think I'm pretty friendly when I meet a client for the first time and pretty open and
Mm-hmm.
smile and shake hands and pretty forthcoming. But I don't know. But you're making me think about this a little bit more. Like, why is that? And yeah, where am I situated in all of this?
That's the cultural humility. You're doing it, right? Like this is how, I mean, it's an ongoing reflective kind of thing. Like, oh, how come these types of clients from this background ask me more questions? And how come these ones maybe don't? And what is it about me or what is it about them? And getting really curious. As you were talking, I was thinking, I also have things in my office. So I have like rainbow hearts kind of put up in different places,
Yeah.
generally where someone would be able to see it when they're sitting anywhere in my office. Or I'll have like gifts that were given to me by indigenous clients, right? Situated in a place like some beadwork or some
Yeah.
sweet grass and for me, like I know there's different opinions about this, right? So some psychologists will say have nothing like that around because it shows your biases. But I'm more like I want to show my biases, and for me, those those intentionally placed things that are in sight for me hopefully allow people to feel comfortable and like you are welcome here. So even though I'm a straight white male, I am open to hearing about your homosexual relationships and sexual orientation and like that is welcome here, right?
Yeah.
And I think that's why people often gravitate to people like them because they feel more welcome, right?
Yes.
So
Yes.
how do we make space? How do we allow people to feel welcome if they come from very different backgrounds?
Well, I also think that it sort of equalizes the power dynamic when you have different items or objects or artwork that shows your humility, right? When someone comes in and let's say you had a very sterile office, that can also communicate perhaps that you're a very serious therapist. Like you just want the person to come in and you just want to talk about the issue. And when the hour or 50 minutes is up, you're out, right? But I think if you like make your place warm and inviting and show that, look, like again, non-verbally and just creating an environment that shows like I'm open to all sorts of different cultures and things. And I think that helps you as a therapist. And again, it sort of communicates to the client that I'm I'm open,
Yeah, I'm you said serious and I was like or professional, right?
professional, yes.
And I think some people are really looking for that professional person and that is possibly going to be the best thing for them. Others are looking for someone who's a little more flexible or open or less structured or less, professional. So I have like a professional title, but I go by Dave, right? Like when people are like, what do we call you?
Yep.
So there's a lot of like
Yeah.
little things that I actually do intentionally, right? And there's things that
Yeah.
I probably do unintentionally and that I'm not aware of, but I try to be reflective and thoughtful about it. And knowing that it's not going to work for everyone, right? Like I have a certain way of being that is going to be helpful to some people and not everyone, and that's okay too.
Well, you bring up a really good point. It's the culture that you set in your office, right? Or even your team sets in the office. Like similar to you, I will just tell parents, call me Andrew.
Hmm.
The title's nothing if I can't help you. So just call me Andrew. And even that, setting the tone and setting what the culture is in our professional relationship, I often find like it just disarms people.
Hmm.
Now, if they continue to call me Dr. Andrew or Dr. Wong, sometimes I'll still remind them, like, just call me Andrew. Some people will not let that go, fine. Right. But sometimes I'm even pretty intentional in my dress,
Hmm.
right?
Yeah.
Like I work with kids a lot and teenagers. So I sort of look at my client list for that day. And if I'm seeing like teenagers and kids throughout, I'll just show up in jeans and like a loosely fitted button-up shirt. Or like it's Friday, I'll go in a hoodie. And it's just sort of like A, I'm comfortable. I
Yeah.
like being comfortable. I don't need a suit and tie. And B, like I want to set the tone of the office space. And it's an inviting and sort of informal place for us to just chat.
Well, I think you're consciously trying to help the clients feel comfortable too,
Right.
right? How you present, what you wear, right? By you being comfortable, also like you're modeling, being genuine, being comfortable, and probably both of us believe this that like you're going to do better work if people feel comfortable to be open and honest about
Yeah.
who they are and what they're struggling with.
Even just looking at like at your background, you've got children's chairs, right? Again, that's already telling people that, I'm accommodating towards children and you're setting the tone and the culture of your office.
For sure. I love having my kids stuff out and then adults go, "Oh, you work with kids?" And I'm like, "Okay." Like in the back of my head, I'm like, "Is this a good thing? Like is this helpful for the work that we're doing?" And
Yeah.
for a lot of adults, it is. They're like, "Oh, well, yeah, I have kids," or like there's a connection there. And I remember even like in my training, like I had brought an adult client to the playroom and it was one of our best sessions, right? And it was like, oh, so again, I'm monitoring and I'm trying to like see what people are gravitating towards. What do they notice in my office? Some
Yeah.
people are reading the book covers on my books, right? And they're like, oh, what's that about? Or like,
Yeah.
oh, and they're looking for clues about like who I am and how I work
Yeah.
with the books that are on my shelf, of course,
Yeah.
right?
Yeah.
So
Yeah.
I think if we can be intentional even with that, it's like have a look around my office, like how comfortable do you feel? If I adjust the lights, like I have different options. I have bright lights, I have softer lights, I have soft chairs, I have hard chairs, like I have options so that you can
Yeah.
be more comfortable in this space, right?
Yeah. And I think the other piece too, like beyond the environment, is just being aware. In the last episode, you talked about privilege. And, as a therapist, as a psychologist, I'm not going to sugarcoat it. Like I've been very lucky to be in this profession and, we are not short of referrals and we're busy. And so I have been able to provide opportunities for my kids. But again, I'm very aware of that privileged position. I don't know if you do this, Dave, but like I don't always tell clients where I might be going for vacation.
Mhm.
I don't disclose all the opportunities that my kids have because I'm hyper aware of that. And when I hear another person's story and I know where they are situated, I'm very mindful. I'm very cognizant to not disclose that about myself.
Mhm.
And again, I wonder if that plays into the humility part and just trying to be a very mindful and aware psychologist.
And our training and our ethics, like with all self-disclosure,
Yeah.
it's done in the client's best interest, right? So I'm not going to talk about my vacation because I'm excited about where I'm going, and my
Yeah.
client, like, that has nothing to do with why they're meeting with me. Like,
Yeah.
yeah, so I think you're very mindful of like how much you disclose, what you disclose, and how it might impact the person you're working
Exactly.
with.
Even though like people may ask, because I will say I'm taking a week off or taking a couple of weeks off, and people may ask,
Hmm.
right? But I'm again just being aware of who that person is across from me.
Hmm.
Do I disclose or do I not?
Yeah, yeah. I know you when you mentioned like what did you say, privilege, or like, yeah, very privileged. Like some of the lessons, the biggest lessons I've learned is, from my clients, and especially a lot of my like indigenous clients. So there's a program, First Nations Inuit Health, that if you have treaty status, you can access counseling, and I'm a provider or a vendor for that program. So like I had this client for a long time that I don't want to know not too many like details because I'm very mindful of confidentiality. But let's say this client, I'd go into the waiting room and the client would call me sir. And then I would respond with an equally kind of formal response. And then the client, once we get into the office, the client says, I call all my colonizers sir. And I was like,
Oh,
oh, like
wow.
now, yeah, like I am finding like you said, situating myself and my own privilege and it just highlighted it. It was like, I represent, white colonizers, or, like the settler group, or like, this is what I represent. And this person is in this group. And so how do we navigate this space? And how do I get curious about like, why this indigenous client would want to meet with a colonizer in the first place for
Hmm.
their mental health, right? There's more than me on the list, right? And so being able to explore that, or even like have an indigenous client tell me like, you you do this, or you've done this, or you do this, and I'm like, oh, did I really do that? I was thinking in my head like, when did I do that? It wasn't me. It was white people that have done things. And as long as I can kind of hold my footing and be like,
Yes.
I don't need to take this totally personal, right? There's a personal element to it, but this is more than just me. This is society. This is culture. And then, like eventually the client saying, I don't mean you. I mean, the people from the residential school, or the like,
Yeah.
but because of my face and what I look like and the institutions I'm associated with,
Yeah.
I represent something. So,
But think about the therapeutic utility of that, right? As you're sitting there, initially you might be going, wait, what did I do? And then as you reframe that to be like, oh, as a collective society or culture, that's what we did.
mhm,
Like that really helps from a therapeutic level, understanding where that person's coming from. And even for you as a practitioner to say, okay, so this is where I can go with the therapy, understanding, how this person views certain cultures slash me, and can I diffuse that, right? For whatever reason, they're here with me right now.
yeah.
And so like be more curious about that.
Well, and yeah, curious, and like, could this be a corrective experience? Right?
Yes.
Like,
Yes.
could this be the one relationship that this individual has with some white guy where I'm actually getting them water and serving them and
Yeah.
respecting their values and their beliefs and trying to understand them? And it's like, that's where I think healing, that's where I think, there's a lot of potential if we can kind of recognize where we're coming from, recognizing our privilege and our backgrounds, and then connecting with people on a real, genuine, healing kind of way. So,
Yep.
yeah.
This begs the question too, and when we talk about culture, like if we talk about genders and
Mhm.
therapist genders and people call and say, I want to talk to a man or I want to talk to a woman.
Yeah.
Sometimes when you, at least for me anyway, when I read the intake or maybe I meet the person for the first time and you sort of get more information and it's happened to me before where I might think, would having the opposite gender actually be better
Mhm.
for that corrective experience, like you said?
Yeah.
So they might come in and they're so angry with women. Right? I'm
Hmm.
using a man as an example. So a
Yeah.
man comes in, they're so angry with women, right? And they think all women are a certain way. But then it's sort of like, what if we showed this person something different?
Oh, I we'll have to talk more about the men's group at some point, but we used to have one of the clinical directors was female, and actually she's still with momentum. But way back when the group was starting, in the break, we'd take a break halfway through, and she would pass around cookies. She would come into the group room and just connect with the men by like, here, would you like a snack? You know, and it was like like the first half of the group could be like all about upset about being hurt by women, right? And then this woman comes in and she's like offering nurturing and caring and connection and a smile, and it's like, oh, I guess not all women, right? Like it starts to create these exceptions, and just like maybe not all white men, right? Maybe not all. Yeah. And so I think that's where there is a real potential to be like, well, I didn't think I wanted to work with a man because I've been hurt by men. But after this experience, I actually think it was really helpful to work with a man because now my healing was also with a man. And cross cultures, cross genders, that's where I think there's, yeah, a lot of potential.
Well, I think that's why we thought speaking about culture and psychology and society and translating all that into the therapy room is so important because culture is everywhere. Right? We can't get away from it. It's set by society, it's set by government, perhaps, it's history. Everywhere we go is culture.
Yeah, and it's power, it's privilege, it's discrimination, it's disadvantage or marginalization. Like all of these things are inherent in culture, and so if we just pretend that's not there, again, I think we potentially can do a lot of harm. Am I
Yeah.
perfect? Absolutely not, right?
Yep.
But am I trying to reflect and trying to be self-aware and aware of other groups? Absolutely.
Well, this is it goes back to our training. I know a lot of people complain about those reflection papers that we had to write,
Yeah.
and we had to reflect all the time about ourselves. But to be very honest, I thought it wasn't a bad practice at all. Even going back to teachers college. So I think you went to teachers college too, right? Yeah, we both did. And even then we had to write a lot of reflection papers and people complain about them all the time. But I do think it helps us think about how equitable or how culturally sensitive are we as individuals, and how can we use our knowledge about ourselves to better our students and our clients, and to not make certain mistakes along the way that can be detrimental to our clients and the mental health of our clients.
Yeah, I think being able to use our power for good, right? Like recognizing that we are in a position of power, whether you're a teacher or whether you're a therapist, you have inherent power like within your role. And rather than using that in a potentially negative way, you can look at using that in a positive way and empowering others. At least that's how I see it.
Yeah, yeah. So, for any students listening to this or grad students, if you're complaining about reflection papers still, yes, they may be tedious to write, but I would hope that it makes you a better therapist or a better psychologist.
Yeah, I think those papers are important. It kind of makes it formal, and it's almost like it prescribes something that you should be doing. But like I
Yeah.
said, in my experience, a lot of my learning about myself and what I've reflected on has come through experience. So
Yes.
meeting people that are different than yourself,
Yeah.
is the best way for at least for me to identify what are my beliefs, what are my values, what are my biases.
Yep. Yep. And if you think that you have no biases at all, go to a bigger city. Move to a bigger city.
Just go out in public and see who you gravitate towards, right? Like, who do you feel comfortable standing beside and who do you not? And what is that about? And
Yeah.
yeah, yeah, I think
Yeah.
again, we are very privileged. Like, like you said, you have intake forms, you're already kind of, you people that are attending your office already have a certain belief or value,
Yes.
right? So there's already a lot of screening that happens.
Yes.
That's why I say go out, go out to somewhere public, go hang out in a Walmart for a while, right? And just,
Yeah.
yeah,
Yeah.
strike up a
This is why
conversation.
I'll never discount my experience working at a school board or working at a community hospital. It's a humbling experience to know where people come from. Rural Ontario, like people think of Canada as perhaps being like a very equitable country. And again, relatively, I would think
Mhm.
it is, but there are still in rural areas very underprivileged and marginalized people, right? And so I will never discount those experiences as a very humbling and a very educational experience for me.
Yeah, I mean, I think Canada, we try to pride ourselves on being multicultural, and yeah, again, this is going to vary from year to year, from government to government, and what are the priorities, right? And so we could look at our taxation policies, right? Like, how do we tax income and then redistribute wealth, and how does that affect society? And so these are global, macro things, but they can be micro right down to the interaction that you're having with the person in front of you, right? Like in our office,
Yeah.
we've done this all day. We went bigger, smaller, like big picture, zero in.
That's
Uh,
right. That's right. No, you know what? This has been a fun discussion about culture and I think one that is never going to end
mhm.
for as long as we live and practice and follow some semblance of the news, whatever that looks like today. And we can't be blind to it. So I think for me the biggest piece, the takeaway about culture is that it's that it's ever evolving and we have to adapt with our practice.
Yeah, I think I'm with you that this is going to be ongoing. And I think the world and our practice would be boring if everyone was the same, right? Like,
Yeah.
we're all different, and being able to just still connect on a human level, as well as like if you're in a professional relationship and understanding what the roles are, is super important, and negotiating those, I think, yeah. So
Yeah.
you keep going.
We could. One more point I will add, like for anyone who's seeking out a therapist, it's your right to find out who works for you. So just because a referral comes through that says, "Hey, this person was really good, you should check them out," doesn't necessarily mean that person is for you. So as we talk about culture, you can ask questions about where the person is situated. You can ask questions about where they're from. And I hope that anybody who is mindful of their privilege and where they're situated will not take offense to those questions. So
Well, if those questions are important to you and the person takes offense to them, then it's probably
they're
not
not for
gonna,
you.
yeah, just don't waste your time and money and energy. Move on.
Yep, there's other people out there.
Yeah. And so being able to ask those questions, because they are important, even if it is just their professional background and their theoretical orientation,
Yep,
that should be the minimum that you're asking. And then you want to ask more about their background, their current family status, or their cultural background, or like, yeah, I think these things should be at least up for discussion, right?
yep,
Like,
yeah,
they're the lens that we see the world through. So,
that's right. That's right.
ah,
All right, Dave, this was
yeah.
fun. And I think it just makes us think a lot more. And we hope it makes all of you think a little bit more as well as if you're thinking of embarking down this therapy journey. And in the meantime, if you've enjoyed the episode, we'd love to hear from you. Give us a thumbs up, follow, and we'll talk again next time.
even if you didn't enjoy the episode and it just fired you right up, then, like share
We've
your
done our
thoughts.
job.
Yeah. Share your thoughts, express yourself. We'll find, we'll find more by everyone being able to share their ideas and beliefs. So if you disagree, let us know.
We'll have a conversation.
Yeah. Maybe have you on as a guest.
All right. Take good care, everyone.
Take care, Andrew.